Welcome to the show, Mr. Vishal. Please go ahead with your query.
Yeah, good evening, everybody. I have been suffering from pancreatitis for the last 5 years. And now, 2 years back, I was diagnosed with diabetes. My fasting sugar level was 350 and after food was somewhere around 450. Right now, I want to know whether there is some treatment regarding with the use of stem cells for diabetes or not. That's it. That's my question.
Okay. Raheja, did you get him?
Yeah, can you just tell me your age, sir? And since when you are suffering from this disease?
My age is 22 right now and I've been suffering since I was 15 years old. So it's about 7 years now.
Yeah, basically he is a case of type 1 diabetes, and I think the patient of type 1 diabetes, they need insulin for their life. And there are few studies in which they have done a pancreas transplant. And again, as doctor, again it's an autoimmune disease, so it is being noticed that after after a very short time, the beta cell being transplanted or pancreas transplantation, they get destroyed because of the autoimmune process. So it is not really a good choice of treatment at this moment. And beside this, there are few immunosuppressant drugs which are going on trial. Like mycophenolate mofetil is under trial at this moment, and this drug is being tried for pancreatic transplants and the people who had a HLA DR3 DR4 genotype. And for this particular patient, I think he should remain in regular touch with his physician,
right.
And he has to take care of a regular insulin injection.
Right.
Diet control, exercise, and he should keep himself stress free as much as possible.
Right.
And he can do aerobic exercises, yogas, right. And diet which is rich in high fiber.
Right. I think basically these are all the things which his doctor would have prescribed him, so he should essentially be in touch with his doctor quite frequently.
She was talking about the diet. The diet should be planned which is rich in fiber and has a low glycemic index. And when we talk of glycemic index, the body behaves differently to this carbohydrate carrying the same amount of calories. There is a different surge of blood glucose as well as insulin secretion. For example, we take glucose as a high glycemic index at 100%. When a person is taking glucose, there is a sudden surge of blood glucose level in the body. And because insulin is not there in the body, in a normal person, the pancreas is there to pump insulin accordingly, but in diabetic, this luxury is not there. So, if the person is given a diet which is having low glycemic index, like oats, high fiber diet, brown bread, soybean. Like soybean has got just a very low glycemic index, 30%. Brown bread has got 70%, whereas glucose is at 100%. So, we should give the diet which is rich in fiber, whole grain lentils, brown rice, brown bread, and also the carbohydrate should be around 55 to 60% of the calories. The fat should be given in the ratio of 20 to 25% of the total calories. And in that also we should see that we give saturated fat not more than 7 to 10%, because these diabetics, they have dyslipidemia also. Did you get me? And also the protein intake should be restricted to 0.8 to 0.9 gram per kg body weight, because in the long run the diabetics have a serious complication of end stage renal disease. So we have to work on these components from the day one, so that we can prevent the long term complications over a period of 10 to 15 years,
right.
Which can be microvascular as well as macrovascular, which can include your eyes, brain, heart, kidneys, nerves, right. Neuropathies.
Right. Since you mentioned this